Hello, I'm Judy Biggert, your representative in the 13th Congressional District of Illinois. This week, Democrat leaders announced they are ready to force their government-run health plan through Congress by any means necessary. And they are racing the clock to get this bill through before wavering Democrats have to go home and face constituents deeply upset with what they're hearing from Washington. It seems that the more the public learns about this bill, from its backroom deals like the Cornhusker kickback to its $500 billion in Medicare cuts, the more they oppose it. Instead of listening, House leaders have turned a deaf ear to the voices of the American people and plan to stretch the rules beyond the breaking point to pass the Senate's bill. Speaker Pelosi is now considering a plan dubbed the Slaughter Rule, after Chairwoman Slaughter of the Rules Committee, that would simply deem the Senate bill passed, incredibly without ever voting on it. Under this plan, lawmakers would only be asked to take a stand on a handful of their most favored revisions to the Senate's proposal, but not the bill itself. Which begs the question, if this were a bill we can be proud of, why avoid taking a simple up or down vote? As you can probably guess, it's about letting members off the hook for voting to roll the dice with the health care of American families. That's because this proposal contains the same massive tax increases, Medicare cuts, and government controls that the public has widely rejected in two previous forms. At nearly $1 trillion, it fails to curb costs or preserve our quality of care. The American people have a choice, and it's not between this bill and no reform. It's between one deeply flawed proposal and common sense reforms that don't require a lot of smoke and mirrors to pass. Ideas like reasonable medical malpractice reform and letting insurance providers compete for your business across state lines. And ideas with strong Republican support, like expanding coverage for pre-existing conditions and stamping out unfair lifetime or annual spending caps if you get sick. The GOP alternative embraces these ideas and lowers premiums up to 10%. It's time for the crafters of this process to take a timeout from the parliamentary sleight of hand and take a moment to listen to the American people. Thank you for listening to me, and thanks to you for caring about this process.